delivery of healthcare. And my starting point for medical education is simply human rights. So we advocate because people have rights and active duty. So the positive right to healthcare has an active duty on society to provide equitable, fair, just access to healthcare.
In this case, a healthcare provider should be an advocate for a good living, good quality of life, and also being able to be an advocate for the rest of the team, the rest of the profession, and also being able to advocate for especially those ones that have been denied the voice. So it could be, here we are looking at people who live with disabilities. We are looking at the women and health. Here we are looking at the children. So in other words, it's all about being a voice of the voiceless.
Solutions to identify the challenges and be able to stand for the benefit of the community or the patient or your fellow professionals. So that advocacy, again, it's about knowing how to package information, to make something happen for others or for the common good. Mm-hmm. Yeah. And to know who does what, so as you know who to go to for different needs that you may have identified, either within your team as professionals or within the hospital for the given patient care or within the communities to improve health outcomes.
That's like if the community needs to participate, there is someone or some people who will help them understand the situation, get them motivated, and then they can actually contribute to healthcare activities. If funders or government or other people need to support an activity, they need to hear actually the rationale of the intervention that is proposed. So health advocates will convince the population, the funders, the stakeholders, and all people that can help for good achievements in health sector.
In society. But we want to be people of influence in that we can advocate, we can stand up for people who perhaps don't have a voice themselves. And our role as advocates arises from the fact that we understand. We try to understand people, we try to understand the conditions in which they live. So all of the other things we've talked about today in terms of community-oriented care, social and community medicine, are the things that cause us to be advocates, I think, because we see that the conditions in which people live make them sick. We see that the access to food that people have stunts them or makes them sick or limits their opportunities because people are too tired when they go to school because they don't eat nutritious food and so therefore they can't learn. And as advocates, we've talked about our scholarliness and our scholarship. We have to find ways of articulating the needs of patients that we encounter and people that we serve. And I think advocates sometimes has a bit of a funny connotation in that advocates are people who march through the streets and protest. Advocates are also people who very gently make arguments for changes to policy and changes to strategy and changes to delivery of healthcare. I think that's possibly the most important role for doctors, is to be an advocate. I think that's possibly the most important role for doctors, is to be an advocate. And that's largely historic, because doctors were some of the most influential people in their communities. 200 years ago in Europe, they would be the only people in communities with forms of transport. They would always live in the largest houses in communities. They were people of influence. Now, we don't want to simply be people of influence because we're well connected in society. So we advocate because people have rights. And every right, every positive and negative right. So you have a positive right to healthcare, you have a positive right to education. You have a negative right in regard to being interfered with when you walk down the street. Yeah? So we have a right not to be interfered with or not to be retarded in our progress as we walk down the street. And we call that a negative right. But every right has a consequent duty. So there are active and passive duties. So a positive right has an active duty. So the positive right to healthcare has an active duty on society to provide equitable, fair, just access to healthcare. And also negative rights have passive duties. So we have a passive duty as members of society not to interfere with people as they walk down the street or not to impede them. But that active duty it is in part about advocating for people. You know, what is it about the right to healthcare that requires us to demand that right or to effect that right?